All right, good morning, guys. It is Wednesday, April 15th, morning session here for the respiratory system. So, wait to see if anyone checks on in. Be going over some parts of the respiratory system along with respiratory illnesses. So, that's what we'll be talking about for today. And if you have any questions about your project, perfect time to ask during this live stream. So, I'll wait for a few more people to come on in. You want to say hello or good morning? Looks like I got one person in here so far. Morning. You can write your questions on the live chat bar. Okay, hello. We have, is that Peyton? I want to say that's Peyton for some reason. Yep. All right, Peyton, how are you today? Any questions you have about the project or the assignments? I believe I got yours. I think you sent yours in yesterday. Let me double check. You did send it on an email, right? Yes, I know that was Allie's I got yesterday. Okay, yeah, I don't have that, Peyton. I did not get yours. If you could resend your project to me. I got Allie's project under that email. I did not get yours yet. Let me just do a double check. Okay. Um, for the respiratory system. Yeah, if you could resend it. I did not get yours. I only got Allie's for the respiratory system. So if you could resend it to my email, or you could send it on Microsoft Teams. Either way. Okay. Hi, Soraya. How are you this morning? Any questions that you may have? Soraya or Peyton about the projects before I talk about. Good morning. Hi, Carly. How are you as well? Any questions that you may have with the project, you could type on in. I'm going to talk about respiratory illnesses for today, some things you could include. All right. All right. I'm glad you're good there, Soraya. Good job. I'll continue talking about the parts of the respiratory system. Make sure you look over the vocab and do the brain pop as well. Due Friday. So both things are due Friday, brain pop and project. Remember, you are drawing and labeling the parts of the respiratory system. And you're also writing a paragraph about a respiratory illness or disease. It's something that affects your system, your breathing system. All right, so I'm going to talk about a few of those right now. So if you have any questions, you can also write in there in the chat. Infections of the respiratory tract can occur in the upper respiratory tract, the lower respiratory tract, or both. Okay. Organisms capable of infecting the respiratory are viruses, bacteria, and fungi. Those are some of the three main ones. I know with this coronavirus, it is a type of virus. We're going to talk about viruses and bacteria towards the end of the year. So, but that being more specific. All right. So these are respiratory infections. All right. So the respiratory tract is protected by a number of very effective defensive mechanisms. For an organism to reach the lower respiratory tract, the organism must be particularly virulent, meaning like a virus, and present in large numbers of the host defense barriers for it to weaken. Okay. Factors that might weaken the respiratory barriers: cigarette smoking could actually weaken it. Okay, it paralyzes the cilia, the hairs lining the cells of the respiratory passages, and the presence of a pathogen such as a cold or the flu of influenza virus. Influenza is a type of virus as well with the flu. Okay, so the upper respiratory tract, one of your basic ones that you could have done on this project too, which I did not state. Okay, Peyton, I'll take a look whenever if you said you sent that on, if you sent it on emails or Teams. So I could take a quick look. I did not get it on email. I did not get it, Peyton, so make sure you did send it to the right email or the right. I would prefer you do it on Microsoft Teams. It might be easier that way. I don't know if you have the wrong email or not. Okay, I did not get it. Okay, so just to let you know while I'm checking my messages here. The upper respiratory tract are infections such as the common cold. Okay, that could be one that you can include with your project. The most common viral pathogens is a common cold. All right, they enter the body through mucous membranes of your nose and your eyes. That's why I said not to touch your face as much, especially during this pandemic with the coronavirus. They are either readily spread from person to person through the respiratory secretions, and manifestations of the cold include inflamed nasal mucus, okay, and sinus mucus as well, mucosa. All right, you could have a headache. You get inflammation of the pharynx, of the pharynx and the throat. Okay, you got like a sore throat, headache, and usually you have your nasal discharge, meaning like you have you're blowing your nose a lot. Okay, and congestion that way. So a little bit different than the flu. Okay, the flu, you would have a headache, you would have fever, chills, muscle aches, nasal discharge, meaning you're blowing your nose a lot. You cough a lot, an unproductive cough, sore throat. Muscle aches is one of the parts of the flu. You just feel tired more so and fatigue that way. Okay. All right. So let's see if another question here. Okay, my day's going good, Carly. Thanks for asking. And it says, you could just send it on Teams. For Peyton, you see that little paperclip button on Teams? You could send it that way too. You just click the paperclip and then you attach something like your file of what you are sending to me. So see the little paperclip button and then you can send it that way. I believe Sarai, you asked what is the brain pop based on? It's on the respiratory system. It's assigned. So make sure you log in through Clever. Okay. All right. I cannot send it on Teams. You got to log in through Clever for that, Soraya, to do that. Okay, and go to Brain Pop. All right, all right. So just trying to answer some of your questions there you have about sending things and other assignments there. Now, the influenza infection can cause marked inflammation of the respiratory system of the ciliated cells. So the flu infection may also lead to respiratory passages with bacteria, and it is possible for the flu virus to infect the tissues of the lung itself, causing viral pneumonia, okay, which we'll talk about as another one there too. So treatments of the flu, you would need bed rest, lots of fluids, like drinking lots of water, and warmth. And also taking an antiviral drug or the flu vaccine if you got your flu shot this year. Okay, that would be another thing to help prevent it. Provides protection against certain A and B strands. There's a couple different strands of the flu that are expected to be, prevalent in certain years. Okay, the vaccine must be updated and administered yearly to be effective, and it won't be effective until the flu strands are included in the vaccine. So the flu vaccine is usually advised for elderly people and young people and individuals with weakened immune system as well too. Okay. All right. So that's what you could be for that. Now, the comparison of the flu and the cold. All right. If you have a fever, it's very rare for a cold. Usually, you would have a fever for the flu. Okay. Headache is pretty rare for a cold, but it's very usual for the flu. Body aches are mild in the cold, but they're more severe with the flu. These are just comparisons of the cold and the flu. Your weaknesses are mild with the cold. Flu could last up to 3 weeks, okay, with how tired you may be with weakness. Extreme fatigue is unusual with the cold. It's usually usual with the flu. Nasal congestion is very common for both. Sneezing is more so common in the cold than the flu. Your sore throat would be very common in the cold, and then same with the sore throat, it would be pretty common with the flu as well. Okay, so those are some comparisons of the two there. Now, asthma is another one that we've mentioned. Okay. All right. We got a couple other people saying hello. Hi, Faith. Hi. Looks like Vincente's in here too. So thanks for tuning in. If you have any questions, you can write those. Write your answer on your live in your live chat there. I'm just covering over some types of the differences of some of these types of respiratory illnesses that you can be including with your project. Okay, we talked about all the parts of the system from last week. Okay, well, or for Monday we talked about each part, like the nasal cavity, the mouth, the nose, the pharynx, the larynx, your voice box, your trachea, the bronchi, the bronchioles, the alveoli, your lungs, your right and left lungs. All right, so those are some things excuse me, that can be mentioned there. Okay, now asthma. I mentioned asthma as one of your respiratory illnesses, and what asthma is a chronic lung disease that obstructs airflow. And the obstruction is usually reversible. It involves difficulty in breathing due to inflammation of swelling, mucus in the airways, and then tightening of muscles around the airways as well too. Okay, so those are some things with that. All right, so then we have some substances here too that would affect with asthma and how they would, kind of trigger the substance. Air pollutants, dust, smoke, mists. Examples of that would be minerals, rock, wood, smoking tobacco. Those are some agents there. Pollen, mites, molds would be a type of something that would trigger an asthma attack. Trees, flowers, weeds, hay, those would be the examples. Animal dander, birds, cats, dogs would be examples from that. Same with medications that could have effect with asthma, aspirin and anti-inflammatory drugs. Food, eggs, wheat, nuts, those would be some types of examples there too. Okay. Now, the symptoms of asthma, what happens means symptoms of what some things happen is you have coughing, wheezing, it's like a whistle sound, all right, it's wheezing, shortness of breath, chest tightness, sneezing and runny nose, and itchy, inflamed eyes. Okay, so those are some there. All right. Now it says here, can asthma be cured? Okay. Well, asthma can be controlled but not cured. Okay, so if you have some or know somebody has asthma, avoiding triggers or reducing exposure to triggers, using medications to control symptoms. So medications, there's usually two types used. There's long-term drugs taken to prevent excess production of mucus, to reduce the inflammation and constriction of the airway. And there's also a rescue or quick relief drug taken to relax muscles around the airways to improve them. Okay, so those are a couple of things there. What you can do if you have asthma, some things that you could do. Identify and minimize contact with asthma triggers, like some things that might trigger it, like I was mentioned in pollen, animal hair, dander, that kind of stuff. Um, Foods, certain things that can trigger it. Understand that asthma and understand and take asthma medications as prescribed. Recognize early signs that your asthma gets worse, or know what to do when your asthma is getting worse. So those are some things you could do. All right. Another type of respiratory illness, okay, um, another type of respiratory illness is called laryngitis. All right. Laryngitis is an inflammation of the larynx. Okay. It causes a hoarse voice or a complete loss of voice because of irritation to the vocal cords. So if you've heard of somebody that maybe you've heard some of our teachers over the years here. They come to school some days and they can't talk, right? Because we talk a lot. So their voice box becomes inflamed. So laryngitis is another type of respiratory illness that you could have done. You could do for your project on the respiratory system there too, because we talked about the larynx. And the larynx is basically your vocal cords or your voice box. So when that becomes irritated, it forms laryngitis. So that is one there. Okay, you may want to try. Okay, all right. Let's see if any questions here. Peyton, let's see. You said send something here. Send it on email. Let me see if I got it. If it's coming through or not. No, Peyton, I do not have it. I don't know what's going on, so you might have to just keep retrying. So um, I don't have yours. I got Allie's, but I don't have yours. You might want to send it from Allie's account if you can't do it that way. But I don't have yours coming through to my emails. Okay. All right. I'll give you my email just so you have it there at the bottom. It's make sure you're putting the right email address. All right. bferko@coastalcharter.org. So there it is. I put it out there. So make sure you're putting that as the right email address. Okay. All right. Moving on. Bronchitis. Bronchitis is a inflammation of the main passage is to the lungs. So Bronchitis is mostly prevalent in the winter months, okay? And it's a part of the acute upper respiratory system, all right? And it may develop after a common cold or other viral infections of your throat. And it is often with a secondary bacterial infection. So bronchitis is another inflammation of the main passageways, okay? So that's kind of goes along with um, the same thing with kind of with laryngitis, except that laryngitis you more so lose your voice. Some signs and symptoms are you get chilliness, slight fever, back and muscle pain, sore throat, onset of distressing cough usually signals that onset bronchitis, and a cough starts off dry and later produces mucus as well. So some treatments, the patient should rest until fever subsides, drink plenty of fluids, and also take a fever reducer. Okay, so those are some things for that one there. Now, many of you guys might have had strep throat as well too. Okay, strep throat is another type of respiratory illness as well. Strep throat's a bacterial infection of tissues in the back of the throat of your tonsils, and they become irritated and inflamed, causing sudden severe throat. Okay, sore throat. So strep throat is caused by what they call streptococcal or strep bacteria, and there are many different strands of strep bacteria. But some of these which are more serious illnesses than others. So that's going to be another one there. And it's usually with your tonsils getting infected in the back of your throat. So some common symptoms of strep throat, sudden severe sore throat, pain or difficulty swallowing. Usually you have a fever over 100 degrees, okay? The swelling of your tonsils, like I just mentioned, and your lymph nodes, white or yellow spots on the back of your of the bright red throat. Okay, headache and abdominal pain. Um, Strep can also cause red skin rash, vomiting, loss of appetite, feeling of discomfort. Those are some things there too. Okay, all right, moving on. Any other questions so far? Checking my questions here pertaining to this project. So make sure this is the time to ask about your project. No, Peyton, did not get it. I know you. If you've sent it, I don't know what's happening. I don't have your project, so I would keep trying through email or Microsoft Teams. So either one of those ways is to send it. Hopefully, you're on Microsoft Teams. That might be easier if the email is not working. You can go ahead and use the paperclip button on there to attach a file, just like where you were chatting with me on there. So you asked me where to send it, so you could pull up an attachment that way. So maybe try it that way. Okay. All right, moving on. Strep throat will usually go away in 3 to 7 days. However, strep throat is still treated with antibiotics, even if they do not speed recovery. All right. Antibiotics kill strep bacteria, shorten the time you're contagious, and reduce the risk of complications such as infection spread to other parts of your body. Your health professional also may recommend non-prescription drugs or non-prescription medications to relieve pain and discomfort and reduce fever caused by strep throat. All right, pneumonia is the next one I'm going to get into. So pneumonia is most deadly infectious disease in the United States. It's also the sixth leading cause of death. Okay, so that's one there. Now, pneumonia is a lower respiratory tract where it's going to be more around your lungs. That's what that means, lower uppers in your throat, lowers down towards your lungs. So individuals most at risk for pneumonia are elderly people, people that are old, those with viral infections, the chronically ill, smokers, patients with chronic respiratory diseases like asthma would be another type of person that could probably get pneumonia too. Pneumonia occurs when bacteria, most common streptococcus, chemical irritants or viruses get into your lungs. Okay, and pneumonia causes the alveoli in the lungs to fill with pus and other liquid. Thus, this causes difficulty in breathing. Okay, so that's what happens with that. Okay. All right. Let's see. Any other questions here? Faith, you're asking. Oh, okay. You're trying to help Peyton there. Try a PDF file. Yeah, PDF. You might want to try that. I could check on PDF files too, if you can't get it through Teams. All right. All right. So check that as well too. So I'm kind of doing both here, checking and giving you guys the information that you need to know. All right. So um, pneumonia. Going back to pneumonia. Um, Pneumonia, like I was saying, it causes the alveoli and the lungs to fill with pus and or other liquid, and it causes difficulty in breathing. Okay, it's hard to breathe. So pneumonia basically is the inflammation or infection of the alveoli in the lungs. Remember, the alveoli are the little sacs in your lungs that have the gas exchange from carbon dioxide and oxygen there. So some symptoms of pneumonia: fever, bluish skin, difficulty breathing, an increased pulse, meaning your heart rate's going faster, a mucus cough, okay, like you're coughing up mucus, and kind of like mental confusion, kind of someone that's kind of disoriented. Okay, those are some symptoms for pneumonia. Now, to treat pneumonia, for some treatments of pneumonia, to treat pneumonia, a doctor would choose an antibiotic, all right, mainly based on your health and how serious the pneumonia is and how old you are. So amoxicillin is an antibiotic medicine that's sometimes prescribed by doctors depending on how bad the pneumonia is. Okay, if pneumonia isn't bad, the infections can be treated at home with oral antibiotics. Okay, like pills and stuff like that. Okay, and drink lots of fluids as well, lots of water, lots of liquids. Okay, all right. So those are some treatments of pneumonia. All right. Any other questions so far? So far, so good. All right. Excellent. Okay. The next respiratory illness or disease I want to talk about is called emphysema. Okay. Emphysema is a chronic, long-lasting disease that gradually destroys the lungs. This destruction means that you become unable to breathe in enough oxygen. You also have trouble breathing out carbon dioxide, okay, as well. All right, um, so this one also destroys gradually destroys the lungs. It's a chronic illness, okay, and it's hard to breathe well. Kind of similar to pneumonia, but cigarette smoking is by far the most common reason that people develop emphysema. So if you're a cigarette smoker, that's why I would encourage you not to smoke cigarettes, especially at a young age, or anybody in your family. All right, they have an easier chance of getting emphysema, and this is also the most preventable cause. So other risk factors include air pollution, heredity, your age. Those could be some risk factors with it. But um, cigarette smoke contributes to this disease process in two ways. All right, it destroys lung tissue, which causes the obstruction. It causes inflammation and irritation of the airway that could cause the disease to get worse as well too. So basically, cigarette smoke causes this one here. All right. All right. Our next disease I'm going to talk about is one called tuberculosis, another respiratory illness, or they call it TB for short. Okay. All right. So TB is a disease caused by a bacterium, Mycobacterium tuberculosis. The TB bacteria can affect any part of the body, but usually affects the lungs. If not treated properly, a person with TB can develop TB. If a person develops TB and does not get appropriate medical attention or treatment, he or she possibly could die. All right, so how do you get TB? TB is generally spread through the air when a person has TB disease frequently sneezes, coughs, speaks, or sings near another or is near somebody for a long period of time. People who breathe in the air containing TB germs can be infected with TB. So typically, only close contact of a person who has TB are considered to be at risk with it. Okay, so this is another one here is tuberculosis. All right. Now, how is TB infection different from TB disease? So they're a little bit different. People with TB infection have a positive TB skin test, but they are not sick. They do not have symptoms and cannot spread TB to others. Um, but they can develop TB disease if not treated for TB infection. So TB infection greatly reduces the chance that you will develop the TB disease. Okay, so how do I get TB? So a TB test is performed by injecting a small amount of fluid under the skin. It's usually in your arm. Okay, in the lower part of your arm. You will need to return usually to your doctor about 48 hours, like 2 days after you had that procedure under your arm, like it's like a little shot under your arm. And they have to train healthcare professionals see your skin test if it came up positive or negative. So you can have a skin test at your local health department or a healthcare provider. If you have a positive reaction to skin test TB infection, your healthcare provider may do other tests to see if you've developed TB disease. Okay, so that would be one there too. It's like where it goes under your arm and it shows like a little circular dot there. All right, so what are the symptoms of TB? Symptoms of TB include feelings of sickness or weakness, weight loss, fever, night sweats. When TB disease affects the lungs, additional symptoms include a bad cough that lasts longer than 2 weeks, shortness of breath, pain in the chest, and coughing. Okay, coughing up blood. All right, for TB. So, how is TB treated? It's usually cured by several medications for 6 to 12 months. It's very important that people who have TB disease take the medication exactly as prescribed. If you stop taking the medication too soon, you can become sick again. So if you do not take medication correctly, the disease may become resistant to the medications before more difficulties to be treated. Okay. All right. Any other questions so far? All right, excellent. I'm moving through some of these respiratory illnesses here, so you can stop and ask any questions that you may have at this time. I'm pretty much wrapping up here on going through all the ones I have, so I have a few more here. Lung cancer is another one I mentioned on your assignment there too. Lung cancer is a respiratory illness. It's the #1 cause of cancer-related deaths by far in the United States, more than breast, prostate, colon cancer combined. Okay, so other types of cancers. So risk factors. If you're a smoker, like I said, please don't smoke. Smoking can kill, and it could cause these risk factors. 90% of all cases of people that smoke will develop lung cancer. All right, secondhand smoke, 25% of non-smoker cases. That means if you're around somebody that smokes a lot, 25% of it will, you could get lung cancer from that. And occupational or environmental lung cancer, if you're in a polluted area, is another type of way to get lung cancer. Okay, what are some symptoms of lung cancer? Fatigue or tiredness, cough, usually shortness of breath, chest pain, loss of appetite, coughing up phlegm, which is like mucus, all right, or coughing up blood. If cancer has spread, symptoms include bone pain, difficulty breathing, abdominal pain in your stomach, headache, weakness, and confusion. So those are some things for that one for lung cancers there. All right, any other questions that we may have? All right, going back and forth here. Good job. All right. Okay, how is lung cancer evaluated? So how do you know if you have it? So because most of all patients will have a tumor in their lung, a chest X-ray or CT scan of the chest is usually performed. Okay, the diagnosis must be confirmed with a biopsy. So the location of all sites of cancer is determined, and additional CT scans or PET scans or MRIs are ways to detect it. Okay, if it is important to find out if cancer started in the lung or somewhere else in the body, cancer is also could be spread to the lungs to other places as well. Okay, so how is lung cancer treated? Well, treatment depends on the stages of the type of cancer. Surgery can be performed as well. Radiation therapy along with chemotherapy. So options that include combinations of drugs. Targeted therapy, and lung cancer is usually treated with a combination of all these different types of therapies: radiation, chemotherapy, targeted therapy, and of course surgery. So those are some there. Okay. Okay, I went through all the main types of I went through all the main types of common illnesses for the respiratory system. So if you have any questions on that and what to do, your project is due Friday. I will be back on here this afternoon as well too for the last session this week for you guys, um, talking about the same stuff and just kind of going over to the respiratory system in general. So um, let's just do a little question and answer right now. See, this was from some stuff from the other day. See how good your memory is on some of the terms of the vocabulary that I've given out to you guys here. So another name for the throat, this area right here. What is a scientific name for the throat? It's part of the respiratory system and digestive system, which we studied last week. All right, it's a common pathway for both food and air. What is it called? You could write your answer in the sidebar. Hi, Beryl, how are you? Looks like you joined in here. Just doing a question and answer right now. It's not the esophagus. Good try. Esophagus would be more the tube that connects your. It's for food, kind of going from the to your stomach, from your throat to your stomach. But I'm talking about the name of the throat. What is the scientific name for the throat that we studied? It's the common space by the respiratory system and the digestive system. It's called the common throat. It's called the throat, and it's a common pathway for air and food. Okay, very good. You got that right. The pharynx. Good job. The pharynx is the back of the throat. The tube itself, the windpipe, is the trachea. So good job, Vero. I was going to ask that one there next. So yes, okay, it was is the trachea. So good job. All right. So trachea is also part of this system as well too. What is the part below the throat? It's also known as the voice box. Okay, or your vocal cords. What is that called? Okay, you put the bronchioles? No, it's not the bronchioles. It's right below the pharynx. Okay, it's like right in here, this area. Your vocal cords. What are they called? What's the scientific name for your vocal cords or your voice box? Nope, not the bronchi. That's going further down. The larynx, very good. The larynx is your vocal cords, very good. All right, excellent, good job. Okay, how about as I continue on? Um, This is a organ in your body that is conical shaped. You have two of them. Okay, one has three lobes. The left has two lobes, and the right has three lobes. What are they? They're conical shaped organ. Helps for breathing. You have two of them, a left and a right. Your left has two lobes. Your right has three lobes. What are they? Yes, very good, Peyton. They are your lungs. Okay, do you remember which one has which? Your left lung has how many lobes? Your left lung has how many lobes? Remember, your heart sits under your left lung. So that should be a clue. How many lobes does your left lung have? Two, very good. And in your right has three. Okay, the right has three lobes. All right, good job. All right, just going over some things I've covered from Monday. This is a review. Okay, all right. Now, as air enters your lungs through a system of pipes called what? These are these branches. I think one of you guys might have mentioned it earlier. Air enters your lungs through a system of pipes called what? As they come down through the trachea, they kind of branch off into these pipes or these branches. What are they called? Nope, not the alveoli. It's something else. I believe you mentioned it earlier. No, not the Cambria. I don't know what the Cambria is. That's not a term that we've studied. So they branch off into these branches. These are airways that kind of connect into your lungs. What are those called? So air enters your lungs through a system of pipes or branches. What are they called? Nope, not the esophagus. All right, the answer for that one, I'll put it in here on the spot. You said it earlier. It was the bronchi. All right, that's what I was looking for right there, the bronchi. All right, let me ask you this next one here. Um, this is where the important work of gas exchange takes place between the air and your blood. All right, remember they're sacs inside the bronchi and the lungs. What are they called? This is where the gas exchange takes place. I believe you also stated this one earlier, but it was not the correct answer at that time. Peyton, I think you mentioned that one earlier. Yes, very good. Alveoli. Excellent job. So that was the alveoli. So good job on that one there. Okay, excellent. Couple more questions here. Oh, this one here. This is a flat muscle underneath when you're breathing. Remember, we're talking about inhaling and exhaling. It's underneath the rib cage. Okay, so what is this one called? So when you inhale, it goes up. When you exhale, it relaxes and goes down. It's a muscle. It's an important one there too. So what one is that called? That's one that you should include. All right. Yeah, Peyton's on fire. He's getting them all right. Yes, very good. The diagram or diaphragm. Very, very good. So excellent job, Peyton. So you've gotten all these majority of these right. So even Beryl's cheering you on. It looks like there too. So good job, Peyton. All right, excellent. Or anybody else in here can help answer some of these here too. Okay, so that was the diaphragm for when you inhale and exhale. So remember we talked about that with through breathing. All right, just a couple things for today, just as a review. I'll go over some of these illnesses, and you tell me what they were, according to maybe the symptoms and some of the signs that I said. All right, this illness, if you have, okay, this respiratory illness, it would consist if you're coughing, you're wheezing, you have shortness of breath, tightness in your chest, itchy eyes, okay, and it can be controlled, but it cannot be cured. All right, and there's usually a couple types of drugs. You usually see somebody with an inhaler to help out with that there too. So that would be um, ones there for that as well too. So what kind of respiratory illness would that be? All right, you mentioned the flu. No, not the flu. If somebody has an inhaler, that could be a dead giveaway. They have a trouble breathing. They have trouble breathing. It cannot be cured, but it can be controlled by taking drugs, okay, medications, and using an inhaler. All right. They have a hard time breathing. They have like a wheezing or whistling sound, shortness of breath, tightness in their chest. So, what kind of respiratory illness would that be? I know you mentioned the flu. That wasn't the flu, but the flu was one we covered. Okay, very good. Asthma is what I was looking for. Good job. Excellent, Peyton. So, asthma would have been that one there. Okay. How about this next one here of some of the other ones I talked about? This is information of your larynx. Remember, your larynx was your vocal cords or voice box. Do you remember the name of that respiratory illness that I mentioned earlier? It's a little harder one to remember. So give you a minute to see if you can figure that one out. It's the inflammation of your larynx. When someone has a hard time, somebody that lost their voice, like a teacher coming to school some days, they can't talk because they may have got sick and they become irritated and your vocal cords become inflamed, maybe because they talked a lot. Okay, that could cause that. Nasal cavity, nope. It's a good try. Flu, it's not the flu. I'll put the answer here. All right, so you can see this one. Okay, it's laryngitis. I think my spelling might have been wrong. It's called laryngitis. Okay, when their voice box becomes inflamed. So that is another respiratory illness. All right, how about this one here? This is an inflammation of the main passages up to the lungs. Remember, those were some kind of branches that we just talked about, giving you a clue that enters the lung. So these are inflamed areas of that block the main passages to the lungs. This is another respiratory illness. It may develop a common cold or viral infections. Okay. All right. And you could have fever, you could have chilliness, back pain, sore throat. These are some things. They need to drink plenty of liquids. So do you know what this one is called? This is another respiratory illness that affects your main passageways to the lungs. Usually get it in the wintertime. It can be met with a bacterial infection, sore throat. All right, those are some of those ones there too. Okay, put cold, fever, flu, viral. Those are all good tries. But this one here, if you paid attention earlier, okay, is called bronchitis. Okay, like it affects your the passageways, the main passageways to your lungs. All right, you could choose any one of these. You could choose any one of these illnesses here. Okay, to do for your project. All right, how about this one? This is one that you may have had before. This is a bacterial infection of the tissues in the back of your throat and your tonsils, where your tonsils become inflamed and irritated, causing a sudden and severe sore throat. What is that called? Nope, not the flu. Okay, sore throat. We call that extreme sore throat. We call that this. You probably have heard of this one before. They call it strep throat. Have you ever had strep throat before? Either any of you guys in here, strep throat? It's very, very painful. It's really hard to talk, hard to swallow. You get really your tonsils get inflamed and infected that way. Okay, yeah, it sounds like you've had it before too there. So mention that yes, you've had it. So yeah, it's very painful. I've had it before as well, and it sometimes lasts the last couple weeks there too. All right. You usually have a fever with it, and it's pretty awful. All right. How about this next illness? This is one of the most deadly infectious diseases in the United States, sixth leading cause of death. It affects the lower respiratory tract, meaning the lower parts. Um, Elderly, those with viral infections, chronic illnesses, smokers will get it. These are some risk factors for people who have it. It occurs when the bacteria of illnesses or viruses get into your lungs, and it causes the alveoli in your lungs to fill with liquid, causing difficulty to breathe. So that's probably one of the main important parts. It causes the alveoli, the sacs, where you do the gas exchange, where they have the gas exchange in the lungs, they fill with pus and other liquids, and it causes difficulty in breathing. So that's what that is. Nope, it's not cancer. It's a good try, though. That was one of the other ones that were said after that, after the fact. Okay, I don't know what you wrote there, Peyton. I can't make that one out. You said cancer in the first one. Okay, like I said, it causes the alveoli and the lungs to fill with pus and liquid, causing difficulty to breathe. Sixth leading cause of death, usually elderly people get it. Those people that are smokers could get it. Chronic respiratory illness. It's in the lower respiratory tract, which means it's more in your lungs. Okay, what is that one called? This is one you could have done for a project. You could have a fever. Your skin could kind of have like a bluish color. You get increased pulse. It infects your alveoli in your lungs. All right. You need to drink lots of liquid. Usually there's an antibiotic like amoxicillin for it. Remember what that was called? Looks like, what do you think, Farrell? Looks like you were typing. Okay, well, I'm going to give you the answer on this one. Okay, since no one got it. All right. I heard of it before. All right, pneumonia. Pneumonia was the answer for this one that I was mentioning. Okay. All right, let me try another one here. This is another chronic illness that gradually destroys the lungs, and this destruction means that you become unable to breathe in enough oxygen, and you have trouble breathing out carbon dioxide. So somebody that's a cigarette smoker usually gets this. This is far more the reason that people develop this one is from cigarette smoke. Okay, so those are some of the risk factors. It's a hard time breathing from it. It's kind of like pneumonia, but it's a little bit different. Okay. So what do you think for that one there? Nope, not lung cancer. It's a good try. Not lung cancer. I mentioned it earlier in the early part of when I was covering the information on here of respiratory illnesses. I mentioned this one here. Okay. Yeah, that could be. Are you saying that cigarette smoke is cancer? Yeah, it can cause that, but this one is another respiratory illness. It's basically comes from um, having a hard time breathing along with cigarette smoke, but it's not lung cancer as itself. Okay, this one I was looking for is called emphysema. I mentioned that one earlier. I also put that in the project as well too. All right. Okay, TB was another one I mentioned too. Tuberculosis is another respiratory illness. Okay, and the last one I was going to mention here is the lung cancer, like you were mentioning there too. So lung cancer is the number one cause of cancer-related deaths. So more than other types of cancer. So 90% of the cases are people that smoke. Some get it through secondhand smoke or their occupation through the environment. So a little bit different than emphysema. So those two kind of are ones that are types of respiratory illnesses caused by cigarette smoking. All right, so a little bit differences between the two. Okay. All right. Any other questions, comments, or concerns? Since we're kind of getting close with time for this week here, I'll be back on at 1 o'clock to 2 around that time frame as well for today. So covered over some of the parts of the respiratory system from Monday, reviewed those, and then went into some of the respiratory illnesses, kind of giving you ideas for your project that you could be doing. So I was providing you some information with the respiratory illnesses for today. All right. So if you don't have any other questions, like I said, you can leave at this time. If not, like I said, I'm here to answer questions. For that, don't forget there's a brain pop too due this week. So you have brain pop and your project due. So two things this week. All right, don't forget you're going to draw your diagram, label it with your parts of your respiratory system, and then on the bottom of it or the back side of that paper, you can write your research on what you came up with on your respiratory project. So include things like symptoms, treatments, how long somebody might live, explain what it is. Okay, so explain your respiratory disease, talk about treatments, talk about symptoms, what happens, how long they might live, can it be cured, not cured, that kind of stuff. So I put that all out there on Microsoft Teams. So I gave you an example with that. So look on Microsoft Teams to get yourself more information. So if you can find, if you have any questions, this is the time to ask. You know it's due by Friday, so you have the rest of the week to work on it. Okay, thanks, Peyton. I'll be on the lookout. Make sure you try to get that sent to me. Your project, I know you had some difficulty sending that over, so get that to me as soon as you can, or through even use Allie's. I know your sister has the account too. You could send it through that one as well too. Okay, if it has problems, or try Microsoft Teams. All right, Peyton. Have a good afternoon, same or morning. Same with you, Veril too. Thanks for participating and talking about the respiratory system with me. Okay, have a good afternoon. I'm gonna end here unless you have any more questions. There's only about 5 or 6 people in here. I think 6 people. So if anybody else has any questions, you can leave or ask. This is the time before I end for today for this morning session. We'll be back on at 1 to 2. Okay, well, I'm going to end a little early here, a couple minutes there we have left, but I want to tell you guys have a good afternoon or good morning, good afternoon. I'll be back on in the afternoon. So any other questions you may have, you can email me or send me a message through Microsoft Teams and or state your questions on here. So I'll be signing off for today. So have a wonderful rest of your day, and hopefully the rain lets up here a little bit. It's been raining the last few days, so we get a good chance to get outside here. All right. Well, have a good afternoon or good morning, and I'll be back on for the afternoon. All right, guys. Goodbye.